Before placing the transducers, it's recommended that you inform the patient what to expect from the evaluation. Explain that you are going to place headphones over their ears and that they will hear a series of beeps or tones. Instruct the patient to follow the instructions and that they must respond by touching the tablet screen. Be sure to stress that during the test, they may hear a swishing noise as well as a tone. They should only respond to the tone. When the patient understands what to do, place the circumaural headphones over the patient's ears, making sure both ears are within the center part of each ear cup. Make sure the red headphone labeled R is over the right ear and the blue headphone labeled L is over the left ear. If adjustments are needed, remove the headphones and adjust the headband for a secure fit. When the transducers are properly placed, testing can begin.